I have selected bipolar disorder as my topic of study. You may have seen this picture before. It was painted by a man who was thought to suffer from bipolar disorder. His name was Vincent van Gogh, and he painted this while looking out from the window of a mental institution. Medical practice at the time did not sufficiently understand his condition, and this may have been one of the reasons he eventually committed suicide. To begin, bipolar disorder is also known as manic depression. It is a disorder associated with the brain and causes drastic differences in a person's mood, activity, and daily tasks. These differences are much more extreme than the usual variations we experience between days. They manifest themselves much more abruptly and almost without cause. Manic depression means that a person quickly switches between a happy or uplifted state and a very sad, depressive state. Someone in a manic state who would be considered having a manic episode is very happy, impulsive, and restless. Someone in a depressive state would be the opposite of manic. They would feel worried, sad, and possibly have morbid thoughts. There are also 4 classifications of bipolar disorder. In order of most to least severe, they are bipolar 1, bipolar 2, bipolar disorder not otherwise specified, and cyclothymic disorder. A study conducted with 61,000 people in 11 countries concluded that 2.4% of people worldwide suffer from a form of bipolar disorder. The breakdown of each category is shown below. Current theory is that there is no single cause, but many factors in unison contributing to the disorder. Genetics is a likely factor since bipolar disorder has been shown to run in families. Environmental factors such as stress and diet are also likely to increase the risk of having manic depressive episodes. The result of the combined genetic and environmental factors results in low dosages of brain chemicals such as serotonin, norepinephrine, and dopamine. There are many studies that define less or greater impacts to the amygdala, hippocampus, or thalamus portions of the brain with conflicting conclusions. One study conducted in 2008 compiled over 7,000 MRI brain scans taken over 25 years. The research did not define a specific portion of the brain that was targeted by bipolar disorder. The symptoms of bipolar disorder usually become prevalent in the late teens or adulthood. People with bipolar disorder develop a different functioning brain. Children with bipolar disorder have similar brain development to children with multidimensional impairment and schizophrenia. People with bipolar disorder are more prone to certain other disorders as well. Substance abuse is common, as it may be seen as a form of treatment to the individual. However, substance abuse only prolongs the manic depressive episodes. Anxiety disorders are also common, since bipolar disorder causes unstable moods. Attention deficit disorder, along with these other diseases and disorders, is quite prevalent with bipolar disorder. In addition to the symptoms listed before, there are many other behavioral effects. In a manic state, an individual tends to be more goal-oriented and have a high self-esteem. They are also very susceptible to failure. When someone is having a manic depressive episode, they are essentially acting as 2 very different people, which is why they have difficulty developing socially. People with bipolar disorder generally have a smaller social circle than other people and are less close with their family. Abrupt mood swings deter people from becoming close with them, and as a result, there's a tendency to develop personality issues such as a need for reassurance and sensitivity to changes in their life. Very commonly, bipolar disorder is misdiagnosed. Mood swings and depression are symptoms of many other disorders, especially considering that there are 4 different types of bipolar disorder with varying degrees of manic depression. In addition to this, there is no blood test or brain scan that can test for bipolar disorder. Treatment methods include medicine such as antidepressants and mood stabilizers. Psychotherapy is also used, such as cognitive behavioral therapy or family-focused therapy. Special treatments may be used for specific conditions as well. Electroconvulsive therapy, which is a more controversial treatment, is used for very severe cases of bipolar disorder. However, it may cause brain damage. If a person has trouble sleeping, they may be given sleep medication as well. There are many types of psychotherapeutic intervention available for bipolar disorder. Family-focused, interpersonal, and cognitive behavioral therapy treatments are generally used to treat both the patient's mental and social life. Interventions have been shown to prolong time to relapse. Work is more difficult with bipolar disorder. Due to the behavioral effects, individuals tend to have poor communication skills, which are important in the workplace. They are also sometimes deemed unreliable due to their unstable moods. To conclude, there is no known cure for bipolar disorder. As technology advances, new insights will be provided about the specific brain chemistry and environmental factors that contribute to the disorder. New treatment methods and medication will be developed. Lastly, people who have bipolar disorder have lived fulfilled lives with proper treatment and special care. While some people, like Vincent van Gogh, definitely were not treated well for their disorder, they were still capable of achieving incredible things, such as Van Gogh's unparalleled artwork.